We're going to talk today about medical solutions for hair loss. I think if you go on the internet or you listen to the infomercials that are out there, there's so many different items and products that are being hawked that can help you. I would really caution you as a good consumer to go out there and just find whatever's out there and try it. I really only advocate two products, both of which I don't make any money on. There's no profit. I don't have stakes in the company. Are minoxidil and finasteride. Those are the only two FDA-approved medications for hair loss. In the video for females or for women, I did say that the minoxidil is the only FDA-approved for women. That's the case. Whereas Propecia and minoxidil can be used in men. I want to walk you through what I think about medical management. Is it important even if you do surgery? What is the role involved with that? And because I take hair restoration so seriously, I really do take medical management seriously as well. I'm going to walk you through each of the medications and what to expect and why I would advocate you're taking it. Let's start with finasteride, which is also known as Propecia. Propecia essentially is a 1 milligram dose of the larger tablet, or 5 milligram, called Proscar, that's used for prostate reduction. I really advocate for you to use the Propecia one, the standard 1 milligram, and not to use the 5 milligrams and try to chop it up like some people do to save a few dollars. The problem with that is unequal distribution and unequal delivery of the medicine every day. It also is a bit dangerous because, especially if a female handles any of the pills that are particularized and ingested and they become pregnant, they can have what's called a teratogenic effect, or a problem with a male fetus's genitalia. So it can cause problems and birth defects if women ingest this during childbearing years. There's also been some extensive studies that have shown that Propecia or finasteride really has not been effective in women even in the postmenopausal. The studies were done in the postmenopausal period. I think the studies are a little bit too dangerous to be conducted in premenopausal women. Finasteride is taken once a day, and here's what I like to tell you. Yes, you have to take it every day, and some people look at that as a burden. But if you're serious enough to come into us to sit down and talk about hair loss, I'm serious enough to tell you that I'm going to give you every type of treatment option out there that can help you, give you serious efficacy and serious benefit in preventing and slowing down hair loss as much as possible. The Propecia tablet that you take once a day, the way that I would like you to think about it is that really it's like brushing your teeth a couple times a day. It's like a good diet. It's like exercise. You do it anyways as a normal regimen, and I would really like you to think about taking a Propecia tablet once a day as part of your daily regimen. It really will help minimize hair loss. Now let me talk to you about what areas of the scalp it works and what exactly the side effects are and what is in sort of the long-term thought processes with Propecia. The problem with Propecia is, yes, if you stop taking it, you lose over a period of year everything you gain. But in my opinion, until we have cloning or hair cloning or other types of maybe genetic manipulations in about 20 years or 10 years, this is the best thing we've got, and I really suggest for you to take it. If you talk to a family doctor, they may not be as serious as I am about medical management, but I am very serious, and I'm very serious about your hair loss. Propecia is something that initially the studies have shown improvement only in the crown. Although the most dramatic improvements are in the crown, it can also affect the entire head, everything from the front of the scalp all the way to the back. Propecia takes about 6 months to a year to take effect, so you may not see the effects immediately. But here's the thing that's very important. Hair loss is like a speeding train. It's something that's progressive in nature, and it continues unrelentingly. When people have taken Propecia in the past and says, you know, doc, it doesn't work, 9 out of 10 men, it really does work. But here's the thing that's really important. Even if you see that there's a little less hair loss and it's slowing down, or maybe there's some regrowth, it's not that Propecia will just regrow your hair. If it did, we wouldn't be doing hair restoration. But it slows down, it regrows some hair, and that's very, very important. And there's different effects in different people. Especially in young people today, when I see a 19-year-old, a 20-year-old, a 22-year-old that may be may be too young to have a formal surgical procedure for hair restoration, because I can't predict where they're going to have ongoing hair loss. At least today, when you see a person in their early 20s beginning to shed their hair and beginning to lose their hair, you know almost without a doubt by the time they hit 30 that they're going to continue to maybe go on to full baldness by that point. And what I say is, at least today, we have the capacity to help these people, help you if you're in that situation, you're a young person, to start on medical management so that you don't have that much hair loss, or at least slow down your progression. And both Rogaine and Propecia are very, very important. I always say that Propecia is about 70% of the benefit and Rogaine is about 30%, but they work synergistically and they work together for benefit. Some of the side effects that I know with Propecia are as follows. One is the fact that there can be a reduction in sexual desire, but it's important that you understand that it is reversible, and it's important you also understand that you should at least try the product out and see if it's going to work for you, because most men simply don't have that problem. It's a very small minority that have that problem, and when they stop the product, it tends to go away. The Propecia is cleared by the liver. It's always a good idea to just get a baseline liver function test to make sure everything is okay. And sometimes in men that are slightly older, say older than 50 or so, it's a good idea to get a baseline PSA. A PSA is a value that is called a prostate-specific antigen. It looks at it's an indicator for potential cancer risk. And Propecia can increase and even at sometimes double your PSA without meaning there's any cancer. So it's always a good idea to get a baseline PSA so that your Propecia will not interfere with an interpretation of what the PSA value is. In terms of Rogaine, Rogaine is a product that's applied topically. It's a product that's applied to the scalp, and that has a half-life about 22 hours, and it can be applied once a day. At this time, we're still recommending that you apply it twice a day. And just like Propecia, it does take about 6 to 12 months before you start seeing the results, although occasionally as early as 3 to 4 months you can start seeing some regrowth. And just like Propecia, if you stop taking it, you will really, unfortunately, lose most of the effects that you would have gained. Propecia and Rogaine are one of those things that are a lifetime commitment. It's important you understand that. So again, Propecia is a pill you take once a day. It's about $50 a month, and it is a prescription that you need to get from me after a consultation to make sure that you're a candidate for it. But minoxidil or Rogaine is something that you don't even need to see me. It's over the counter. You can get this at the store. It is also, unlike Propecia currently right now, Rogaine is something that you don't need to buy brand name for. It's about, I believe, $20 to $25 a month for the brand version, and it's about $8 to $12 at a discount for the generic version. There has been some problems with irritation to the scalp for those that are taking Rogaine on the scalp. And the new formulation that just came out called Rogaine Foam, that currently is only in the 5% for men, although there is one coming out. Maybe by the time this video comes out, the 2% will be available for women. But the benefit of the foam, even though it's a little bit more expensive because it is the brand name Rogaine, it is easier to apply, and it doesn't have propylene glycol, which means there's a lot less chance that you have a side effect with irritation to the scalp. Now, let's finally talk about, if you're going to be using medical management, how do I see that work with surgery? The most common question I have is, well, if I'm going to have a hair transplant, why do I need to take these medications? Or is it something that's irrelevant? Or I don't want to bother with it. It's too much trouble for me. Well, I will tell you, if you're serious enough to come in and consider having a hair restoration procedure with me, I think you should be serious enough to consider taking medical management. Now, let me explain to you how the two work together. With hair restoration, remember I'm taking hair from the back of the head, where even in the baldest male you don't lose that hair. I transplant it forward, and that hair is not going to be lost. The difference, though, is that the surrounding hair is an element that could continue to lose hair. You could continue to lose hair down the side areas called the lateral hump. Your temples could recede, and other areas of the crown could recede. So other areas where you have your natural hair that have not been transplanted could continue to recede, depending on your age, your genetics, and other factors. So what Rogaine and Propecia do is that it slows down the recession of the other areas that could otherwise begin to recede. So, and it still would recede, as I told you, it's that speeding train. You're still going to lose some hair, but it can slow it down, if not regrow some areas. So that's very, very important for you to understand. So I find it very important, because even though I transplant your hair, because there's only limited donor supply, I can only transplant a number of times, I want you to guard your existing hair as to the best ability you can, and that's what Rogaine and Propecia do for you. The other thing that's important is that when I'm looking at the hair here, and you're beginning to have baby hairs, because the process of hair loss is such that you go from very full hair to little wispy baby hairs called vellus hairs, and then you just lose those hairs and then you're bald. In the transition phase, when you get vellus hairs and you're about to go into just complete baldness, what I recommend in particular is Rogaine and Propecia, especially around the time that I am contemplating doing a hair restoration procedure for you, for the simple fact that Rogaine and Propecia can really stabilize those areas, so that when I do transplant it, you don't get a condition called telogen effluvium, which is that you have some temporary shedding that can be very distressing to some people, where you lose a little bit more hair for 4 to 6 weeks after the procedure, which